Health Education Project on the human papillomavirus. I'm Megan,
I'm Mia.
I'm Mariah.
And I'm Angela.
and we're going to be discussing HPV today. So let's go ahead and get started. So, what is HPV? HPV stands for the human papillomavirus and is the most common sexually transmitted infection in the United States. It is a small germ that can cause problems to the body, like warts on the hands, feet, or the genital area. 90% of people diagnosed with HPV are able to fight the virus off on their own within about 2 years of contracting the virus, and they may never know that they had HPV in the first place. If the body is unable to fight it off, HPV may develop into cancer or other issues, such as warts. HPV is much different than HIV and HSV, and HSV is sometimes known as herpes.
Symptoms of HPV. Most people with HPV never develop symptoms or have any resulting health issues and are not aware that they have HPV. The primary sign of HPV is warts on the patient's genital area. Patients can also experience bleeding during sex, itching or discomfort, sore throat, enlarged lymph nodes, and or changes in bowel habits. You can have HPV without these signs and symptoms as well.
How is HPV spread? Anyone who is sexually active can get HPV. HPV is spread through all forms of sexual contact from someone who has the virus and through close skin-to-skin contact during sexual relations. HPV can spread even if the infected person does not have any signs or symptoms of infection. It may take years to develop symptoms after becoming infected, which can make HPV very difficult to detect.
How can I prevent HPV? HPV can be avoided and prevented by getting vaccinated against HPV and practicing safe sexual intercourse with the use of condoms. The HPV vaccine is recommended for both girls and boys at the earliest ages of 11 or 12 and up to adults at the age of 26. Adults over the age of 26 can still receive the vaccine. However, the vaccine will not be as effective. Additionally, women over the age of 30 need to receive routine screenings for cervical cancer, as HPV can cause cervical cancer over time.
So, if I have HPV, what can I do or how do I get help? So, the first thing that you need to do is go see your doctor or your healthcare provider, like a nurse practitioner or a physician assistant. These are just some primary care specialists who know more information about the virus. So, your doctor or your nurse practitioner or physician assistant is called your primary care provider, or some people know them as a PCP. And many are very knowledgeable about HPV. Women can also see someone called a gynecologist, which is a doctor who specializes in the female reproductive system. The doctor might do an examination to look for any warts or any other signs of HPV. If the doctor finds any warts, a special cream is often used to treat it. Social support is very helpful, so it is usually recommended that you talk to your family or friends about your emotions and get involved in support groups to talk about HPV.
How do I treat at home? At home, it is very important to monitor yourself for and notify your provider for any bodily changes that include abnormal vaginal bleeding or vaginal pain during or after sexual relations. Consistently practicing safe sexual relations by using a condom. Make your partner aware of your HPV diagnosis to prevent passing HPV to others, and stop smoking to decrease your risk of developing cervical cancer. If you have any questions or concerns or need help to quit smoking, let your provider know so that they may provide you with further information and assistance.
So these are the references that we used to discuss this presentation. And while this is on the screen, I just want to go through kind of a review of what we talked about. So we talked about how HPV can sometimes be seen and sometimes it's not. This is just to remind you that HPV is a virus and it's very small. It's not something you will always see, but when you do have symptoms, the biggest symptom will be those genital warts. And it is very important to discuss this with your healthcare provider so they can provide you with the appropriate treatment as soon as possible. And some types of HPV can be very tricky, so it's very important that you go to your doctor as soon as you're having any signs or symptoms, or you've had unprotected sex, or you're just worried. It's always better to be safe than sorry. And then if you're able, the vaccine is one of the most recommended preventative measures for HPV by the Centers for Disease Control. So if you're able to get the HPV vaccine, that is highly recommended, and your healthcare provider will also recommend this as well. And staying safe is the biggest thing. Participating in safe sex, using condoms, and just educating yourself and your partner about any precautions that you need to have to keep both of you and your partner safe. And that is the end of our presentation. Thank you so much for watching this video and for your time and attention.